So good evening, all. Myself, Dr. Kiran Varma, working as head of the emergency Yashoda Hospital, Malakpet. I welcome you all for this series of webinars conducted by Department of Emergency Medicine, Yashoda Hospitals, in association with Society for Emergency Medicine of India and my. See, as we all know that we come up with an interesting topic every week where experts and senior most faculty and speakers, they deliver their talk, they enlighten on us on different topics as well. So then this time it's like leading an year. So as we know that there are many leaders in the field of emergency medicine like Dr. Srinath sir, Imran sir, Sharona sir, Sudhakar Reddy sir, then one among is Dr. Nischal sir. So we are so happy that Dr. Nischal sir is here to deliver a talk on particular topic I'm going to discuss in the later. Okay. Then managing a year, it is not an easy job, what I feel. So because we have to deal with multiple people, there are multiple stakeholders. Stakeholders includes like patients, patient attenders, then clinicians of our own specialty, clinicians of different specialties, staff, then administrative things. So managing in a year is not an easy task at all, what I believe in. So it requires many arms, like multiple skillful hands. So what I believe, ER physician is like a multifaceted person. It should be like that. Then only you can maintain a proper ER. You can deal with many things. Okay, here. So our focus not only on clinical things, but it should be on something else beyond ER. So by keeping all these things in the mind, we have come with an interesting topic, leading an ER and beyond. To enlighten on this particular topic, one of the leaders in the field of emergency and then one of the main personal in the board, semi-board as well, Dr. Nischal sir is here. So I would like to take this an opportunity. Welcome Dr. Nischal sir. Dr. Nischal sir, welcome you. So for this series of webinars, then podium is yours. Thank you, sir.
Thank you. Very good afternoon, good evening to everybody. A big thank you to Yashoda Group for giving me this opportunity. Thanks to Kiran for the wonderful intro. I will try to match up to what he has set the stage for. Thanks to Dr. Srinath for giving me this opportunity. We are going to look at a very different aspect of emergency medicine today. So I'm sure all of us are, at one stage or the other, as you see on the slide, right? So you have done your MEM, you've done your MD, MRChem, you've done your degrees, now you're working, you're looking, aspiring to be a consultant, aspiring to be a HOD. So what's next? So like what we all work as emergency physicians, our brain is tuned or hardwired to always think what's next, right? So I'm going to take a topic which is not very conventional. So there is no didactic lecture here. There is no didactic topic that is being discussed, and there are no big multiple algorithms and pathophysiology there. So just get yourself cool, drop your guard. Number one, and just listen, sit back, listen to the concept. The question is, are we talking about ER administration? Are we talking about medical administration? Are we talking about leadership? In my view, everything is same. There's a very, very gray area in between all three. So keep your hat open, keep your brain open, and let us see what can be the path post you have done everything, or you have played all the roles in emergency medicine. You can't possibly do everything in emergency, but you have played the roles. So what's next? All right, next slide. This is how most often the life looks at, right? You at every point of your life, you come to this crossroads. One is a very rugged one, but it is quite clear, clean. Everybody knows, taken the path. One is looking very beautiful, and you don't even know whether this is true or it is a mirage. Whenever you are at crossroads of your career or of your life, we just need to adapt a method of thinking what you should do next. right? So this entire talk of next 30 minutes, 40 minutes is going to be that. And I'm going to ensure that I keep the emergency medicine or the emergency department as a backdrop and tell you what you could do to aspire to become a medical administrator, which can be group medical director, director of medical services, head, you can call it whatever, but all summed up into medical administration. Okay, let's start. Next slide, please. When you Google, especially on the Western, websites, what else other than emergency medicine, you will get a host of subspecialties, host of what emergency physicians can do. And, you look at it, there is a huge platter of subspecialties and careers that you can take as an emergency physician. So that we will come to the Indian scenario, but just look at the platter there. You can pick what you like and don't ever start after emergency medicine, after your master's that, oh, I can only do this much. Just look at what is there on your plate. Next slide. These are the number of options you have. I wouldn't say in every geography of the world, but at least in the Western side of it. And these are all taken from, ASF websites. All of you can go look what it is about. It may not be a career by itself, but definitely these are subspecialties by itself. At one stage or the other, going to be a complete vertical or a path. Next. Okay, so we will not discuss 50 topics. We will discuss about medical administration. And the question is, should emergency physicians look at medical administration admin role as the extension or as the next step? Whenever you look at it as a next step, these are the three crucial questions you need to ask yourself. Why do you want to do it? What is it that you need to do to get yourself there? How do you do it? Very basic and very, very practical, correct? So we are just going to learn all these three at the backdrop of a clinical scenario. So I'm not, like I said, this is not going to be one big busy slides to teach you. Next slide. The most important question that I have for all of you is, do you really want to improve? Do you really want to think out of the well-trodden path of emergency medicine? Are you willing to listen? Most often we are not. Most often we are very busy doing what we are not willing to listen. The first and foremost thing that we have to do, forget whether you want to become an administrator or not, medical administrator, even whatever you want to do, first listen, first understand that you have to improve. Traditionally, next slide. Traditionally, this is how we have learned, correct? There's head of the department, there's an expert, you are the consultant, you have residents, and as a resident, you watch, you learn. As a head of the department, you teach, you learn. But then after that, what? So I keep quoting this. I don't know how many of you have heard about the lecture or talk by Atul Gawande, who's given many books. One of the popular one is Checklist Manifesto. So he says, this is how medicine is taught. This is the traditional way of learning for doctors. I'm not sitting here to judge whether it is correct or wrong, but can there be other methods? That's the question. That's the question he asks all of us to introspect. Next slide. So if you look at the picture, the best footballer in the world is being told by a coach. So when the best footballer or the sportsman in the world is being taught, as emergency consultants, HODs, emergency physicians, why do we think that we cannot be taught? We are not talking about workshops. Please understand the difference. Are we willing to allow somebody to look at what we do? Are we allowing them to be vulnerable to learn? And is this the way we should? The question is out there. Okay, so I'm going to leave this as a question, as thought for you. And this is the hat that we need to put and move ahead. Next slide. Very typical scenario. I have tried to keep as less medical jargon as possible, but patient brought in dead, RTA, you have never seen this patient. The patient relatives want certificate. He knows you're chairman of the hospital and he has a huge political clout. So what do you do? So as an emergency physician, these are scenarios that we face in day in and day out. There's nothing, big deal about it as a ER doctor. So do we sit and discuss? So do we ask our chairman, what should I do? Or, let's play it safe. Just give him what he's asking. So the point here that we have to understand is we all have to follow the law of land. So as an emergency physician, you will again fall back saying that, okay, this is a tricky situation. What is it written in the book? No. But do you know what to do? We are so hardwired as emergency physicians that we know what is the right thing to do most of the time. The skill that we use here is that you will follow the law of land and strip away the emotional bits that are adding here. I know your chairman. I know the political cloud. Just do what I'm telling you. So what are you going to do? I'm sure most of us, we're going to sit back and say that, look, the law is clear. I'm going to just raise an MLC. I'm going to just send it for a postmortem. And that's the way I'm going to do it. So this is one of a very, very important skill as a leader or as a medical administrator, that you should know what is the law of land. You should know what is the law of land. You should be quite objective in your next steps. And you should be able to justify this, what you have done, to anybody asked at any later time and date, right? So follow the law of land, be objective. That's one of most important skill that you already have that you can use in a medical administration. Next. Quite common, but I've just added a twist there. Famous person brought dead, which is again common scenario. But here the body is in rigor mortis, and the daughter is asking you to do CPR. But not only that, but she's showing you a video and asking you to do proper chest compressions. So you are in the middle of this, that there is media waiting outside, there is family standing next to you, and you know that rigor mortis is not a clinical indication to do a chest compression, correct? So what do? So you stand there and talk law? Do you stand there and say that, look, there is no meaning in doing it? Or do you just listen to them and continue to do? Or do you, sit and talk to them? Very, very difficult scenario, but you will have to do a bit of both. So what are you going to do? You will generally get this to one of your team members. You will take the patient aside, empathize with them, tell them what exactly is the outcome of this effort. Is there a way, is there a reason that what we are doing or sense to what we are doing? Very important skill that you all already have and what you could be used in a medical administration is learn when not to fight. Learn when you have to get the patient's relatives on your side and fight. The same thing holds good for other people of your hospital. So as an administrator, your one goal is solve the problem. You want the solution. As an emergency physician, you want to solve the problem of this patient. Use the same hat and ensure that you collaborate. Pick your battles clearly, collaborate, ensure you empathize, ensure you listen, but also tell them exactly, not exactly rebel, but also tell them that, look, this is the right thing to do. So you're never scared to tell people the right thing to do and collaborate. That's the second skill. Next. Well, common scenario, I've just put a gastroenterologist there. It can be anybody. It can be a cardiologist, neurologist, and there is another department, gastroenterologist, physician fighting as to who should admit a patient of diarrhea or gastroenteritis. You are an emergency physician. For you, it doesn't really matter. This patient is in acute GE, needs hydration, take him in. But most often you're caught in between the crossfire, right? So what do you want to do? So will you look up and tell your gastroenterologist, say that, look, this is how I'm going to do it? Are you going to tell physician, no, you're not going to do, he's going to do? So what? Are you going to sit and talk to them? Very, very clearly, there are finances involved in this, which, all of us know, but would not want to talk. Please understand there is more to it than what you see. Get your medical administrator with this, put your medical administrator hat on this and say, what is the problem here? Let us not look at it as patient belonging to a department. Let us look at patient as an objective problem where what is the best solution? So be objective, sit and talk to them. There are many forums that you can do it. We've had these scenarios many, many times. And you know how we did? We just brought up these series of 3-4 such patients in a morbidity meeting, in any clinical meeting. We would strip away the names and just say that, look, emergency situations like this, what do you think is the right thing? And there in a forum, when you have more than 1-2 specialties and there are 10-12, you are most likely to get an objective answer to it. So the ability to objectivize the problem and ensure you make a solution where you're not hurting anybody, but you still hold your ground. You still hold your ground and say that, look, we will do what it is needed, but don't put us in between your crossfire. So the ability to use your colleagues, your co-specialties to solve your problems is a skill that you're doing it, but that is also extremely important for you to become a medical administrator. Next. Quite a common scenario. I'm sure all of us have fought this battle or still fighting, and we will continue to fight this, right? You have a lot of patients and you have just 4 staff, 1 doctor, you need more manpower. Your medical head is saying, or your CEO is saying that, look, there's not much of money. This is a very, very important topic for all of you to look and understand what you're going to do here. First thing is, don't go into self-doubt. Don't say that there is no interest of administrators in our department. Don't go into, being the victim. Get out of the victim mentality. Be the leader here. Okay, I have a problem and somebody thinks I'm not making enough revenue. Do you know your numbers? Are you measuring your work? Very, very important is data is your biggest friend. But are you all aware of your data? How many patients do I see? How many patients do I consult? What is the revenue of the department? Sir, that is not my problem. I will only see patients and send, and that's it. I don't think as an emergency physician, we get to do that. And most often we look at all the aspects. Please seek data. Have the data as the objective weapon that you can use to help your administrator. Again, don't ever think your administrators are your, countering you or your enemies. They are there to help you. But you need to give them tools and you need to give them the data so that they can fight on your behalf. Next slide. Overcrowding in ER. I know this is a very popular topic. A lot of people talk about it. But overcrowding in India is a lot different from overcrowding in the West or Europe, right? In India, healthcare is not, insurance based, not a, largely the government's problem. Medical or healthcare is coming mostly out of your pocket. So when I am paying for it, most of your customer, your patients are not willing to wait. So they don't care whether I'm going to emergency, OPD, wherever. I just want my problem to be solved quickly. You just do that. So your hospital is having an overflow of patients. You have limited beds of whatever, 4, 6, 10, 20. So what do? Do you get to refuse these patients? Do you want to refuse these patients? Because they're stable. I'm talking about green patients. The way you look at the problem will determine your level of leadership. Every patient is coming for some kind of a clinical problem, and they're seeking solution. The problem comes to your door because you can solve it. Look at it that way. And please remember, every patient coming in is an opportunity for you to showcase your clinical talent, showcase your department, and do the very best for your patient. This is where opportunity lies. If you want your admin people to love you, if you want your CEO to look at your admin abilities, this is the opportunity. How am I managing this? How am I keeping my patients happy despite having a busy ER? Can you see the patient on a wheelchair? Can you see the patient on a stretcher? There are many times where we had to just make them sit on the chair and say, sir, I do not have a bed, but I know you have come with a problem. I would like to help. Can I examine you? Okay, so you don't go into nitty-gritties. Oh, it's suboptimal. Who will like it? All that. You'll be surprised 9 out of 10 times that's all your patient wants. And once you solve it, your hospital is going to love you because you've catered to your patient, despite you being hands-full, right? Remember to identify the opportunity. Remember to use it in your favor. At the end of the day, you're still delivering care to the patient. Next slide. So you have a busy year going, you have a couple of people on leave, and you have let's say the FIFA World Cup. Or let's say for your city or the place where your emergency is, you have all the famous cricketers coming to play cricket, and your CEO says, now get me manpower to go and be there. What's the first thing we do? Oh gosh, where do I get the manpower? I don't have people, I can't do it. But remember, how can you do this? So can you ask your your doctors, nurses to come out of their working hours? Is there a way that you can incentivize them, both on money? Second is that they would be able to see an event with all the famous people. Also, use that opportunity, that platform, to talk about your department. So again, it is the hat that you wear to solve this challenge. Nothing comes written in rock, and you are the best person to stand on your feet and think a solution for it. And most often these things are not planned. So it's not like next month 15th you are going to have this please plan. No, some things just happen in a day. So the important thing is to be adaptable and agile to the needs. So as an emergency physician, you will do this. But as a medical administrator, that's your number one skill that you need to know. How can I be adaptable? How can I be agile? At the same time, I ensure the patient care is not compromised. Next slide. Most often we keep talking about clinical scenarios, and we just saw some, 8 to 10 clinical scenarios. And the question always comes, okay, where is the problem? Where is the problem? And where is the devil? I don't know how many of you have looked at things in a different perspective, but I'm sure all of you do. Whenever you're fighting the battle of where is the devil, the answer usually lies, or the devil is in the detail. What are the details? What are the details that you need to know? Next slide. I'm sure all of you have, seen your department statistics, seen this, but have you quantified? So we looked at few problems, right? Overcrowding, patient comes and sees you. Somebody wants to park the patient in emergency because there are no beds. Use those opportunities to treat and ensure your treatment is not free. Please ensure you measure every service that you are rendering and what is being billed in emergency should come as an emergency medicine revenue. When your administrator sits in a review, he may or may not understand one side of the slide, but definitely understands the last column. Do you know your numbers? Do you know your details? Do you know? While all of us would know what is door to needle time, what is door to balloon time, what is our return to ER, all your quality indicators you will know, but learn to measure your performance of the department, not just by KPIs. 100% your KPIs are important, but also your financials. Don't shy away. As a leader, as an emergency physician who wanting to become an administrator, you cannot shy away from money. Revenue is something that you need to understand. And the first step to understand is to not shy away, not be worried about it, but sit and look at it. You may or may not get this data, but unless you don't ask, you don't get it. So please ask, make this a platform that you know what is happening and how you can plan. See, your revenue gives you an idea about, okay, how many people have I employed? How many consultants are there? How many JCs are there? How many registrars are there? You will know your manpower. You will know what you're charging for your services. You will know what is the department making at the end of the month. And you will help your administrators to plan for your department by themselves. Your job is to ensure you make the problem very evident to your medical administrators that this is a thing. And if you're aspiring to be a medical administrator, this is non-negotiable. You have to know your numbers. Next slide. So I keep hearing, I've been on a journey for quite a bit now, at least a decade, where I've done medical administration, clinical, both. And I'll tell you what, we are talking about the same problem or same issue, but we use different words. If you look at the slide, we are very, very informal in the way we speak, right? Because we just need to get the work done. I just don't want to be formal, do this, tell that. But your administrators on the other side may or may not understand that language. It makes a huge difference to you understand their lingo or language. When they speak about revenues, when they speak about budgets, when they speak about what are your targets, we are not the people who should be given targets, but you should understand what is the revenue. The terminology may be different, but we mostly, both of us, are talking about the same thing. So I've got this flag a lot of times that you don't understand, but I would look at it this way, that we should understand too. My famous adage to anybody who asks, should I become an administrator? My adage to them is, I like it because I like to sit on both ends of the table. You cannot be sitting at one end of asking and not knowing or not wanting to know the other person's perspective. So the first role of an administrator is to put yourself on both sides of the table and put the problem in between. Look for solution. Next slide. Now that we have kind of put the context very clearly, we've gone through the scenarios. I've told you what does a leader do, what does an emergency medicine consultant do. Now, how do I become a medical administrator? I'll tell you what. You need external degrees, which are written here. Yes, it helps to do an MBA. So should it be IIM? Should it be BITS Pilani? Should it be any other, very well-known colleges? In my view, the most important thing is purpose to do it. First, it doesn't matter where you do your MBA. At the end of it, it all boils down to whether you want to do this. And if you want to do this, you can do MBA in any of the places. It really doesn't matter as long as you learn the basics. But when I was doing MBA a decade ago, many people asked, why are you doing? But I realized that if I plan to do that in my career ahead, I need to know that. I need to know the language of people, what I'm going to face, or the role that I'm going to play. So please know that it helps to do MBA. What? So without MBA, can I not be an administrator? Not really. You can still. Next. I honestly believe the biggest changes come with the smallest steps. Every brick by brick is how a whole house is built. I'm sure all of you know that. So if you want to or pursue medical administration as your additional career, next career, please remember, start exhibiting these leadership qualities in whatever work you're doing right now. That's the best place to start. Second, once you have these small bricks put together, look at a formal education like we just spoke, MBA. Sit with your administrators. Do not go into the room saying that I know all, he doesn't know. Most often I've seen people walking in saying that, I know everything, he doesn't know anything, or he doesn't understand. Well, if he is not understanding you, the onus is also on you to make him understand. Correct? So please ensure you have your small bricks, your foundation to go where you want to is clearly built. And I am at all time telling you, don't say that today I will stop practicing everything. I will do MBA, I will do this. No, you don't have to stop something to start something. As you're working, as you're doing your current clinical job, you can parallelly build your admin bent of mind, admin muscle, by developing this mindset, developing this skill, like we just went through few clinical scenarios. So don't stop and do. Continue to do what you're doing, parallelly build up what you need to get you to the role of a medical administrator. Next. These are typically the aspects of a medical administrator. So you can't say, I will become administrator, I'll take care of only emergency. Possible in few big, large organizations, yes. But generally, these are the aspects for you that you need to learn. I am pretty much sure as emergency physician, we understand a bit of quality, but quality comes in various terms. It can be in terms of KPIs, NABH, JCI, many things. Trust me, you need to sit and read on this. I did all NABH JCI training. I went through many audits, and it took me a while to understand what it is, but it's no rocket science. You can definitely understand and learn, but you got to sit and read this. So don't just think that what I know as KPIs in emergency holds good for the entire hospital. Not necessarily. Sit and read. Quality is very good to know, as a doctor. Policies and protocol. I don't know how many of you have written your clinical manual for emergency. So it's as simple as that. Clinical manual for your department, if you make from a scratch, you will know how to make policies and protocol for the entire hospital. It's as simple as that. Please trust me. If you have had a manual and you have not had looked at it, go back and look. How is it written? How are the protocols written? How are the policies numbered? What is the heading of the policy? What is the standard? What is the purpose? What is the objective? Please look at this, because if I have to become an emergency physician, you will need to know how protocols are done, but you may not need to know how policies are done. So as a medical administrator, making policies is one of your core job, and you're not reinventing wheel here. You don't have to, because generally there is something lying around, but it is up to you to make it relevant for your organization, and this can be easily done. Clinical research, this is one aspect. As a medical administrator, you're part of many boards and you will do clinical research at that point. There are topics or workshops that you can learn and do this. Conflict resolution, all we just looked at the clinical scenarios was all about conflict resolution. And I keep telling this, remember this, as an administrator, your work is to do mostly with people. If you're good at people management, you will love that job. I'm sure all of us know evidence-based medicine. Strategy is something you will learn. There is no book to teach you strategy. This is what you will learn. That is called experience of handling situations. Last, but the most important, as doctors, we all think finances are not my problem. I beg to differ. It is our responsibility to look at every finances, learn. Formally learn, practice it. Don't be afraid to look at numbers, ask questions, learn, and you can master finances. It is not as difficult as knowing the pathophysiology of your ARDS. Trust me. Next slide. I have left few comments why an emergency physician can be a good medical administrator. ADHD, all of us cannot keep doing the same thing for the entire day, right? I come, I see a patient, I stabilize, move. As an administrator, you will continue to face this, that you are going to have multiple problems coming to you, and you will be forced to go from one to another. Expect the unexpected. All of us do this. We don't know what is going to walk through the door, right? We are ready. The same way as an administrator, you do not know what is going to come next, but you will be prepared. We are not people who are worried about unknown. We know if unknown happens, the one thing that I think goes through in our mind is, I'll deal with it. Correct? The most important skill, in my view, as an emergency physician, which helps us to be a good medical administrator, we can think on our feet. We are very good at thinking at our feet because your reaction time is very, very low. You are very quick to triage it quickly in your brain and do the next best possible thing. This is a skill that makes you a good ER administrator. Yeah, we face difficulties. Like I said, we are not averse to conflict at all. Let's not thrive on it, but at least I'm not worried that somebody is going to come and fight with me. Okay, if he comes with fight to me, I will sit down, I'll talk to him, I will put sense, and I will argue my case. Unlike most of the specialties, emergency is action-oriented, right? It's always action, action, and action. In administration, trust me, there is never a dull day. You will face action, but it's on a different level, different plane. But the people who are used to action don't have to worry about it. It is so difficult to tell anyone that their loved one is no more. Correct? When we talk communication to our own physicians, tell me how many of us are comfortable to say your father is dead. You can say he had a cardiac arrest, his heart was not beating, I tried to resuscitate, nothing happened, I'm trying, all that is that. You have to say the golden words. We as emergency physicians are very, very good at telling the truth and the most difficult thing, right? So you will not shy away from, as an administrator, telling the truth to your fellow colleague doctors, nurses, or anybody else. Being an emergency physician, you're forced to collaborate. I will put it as this way, that you have no choice but to collaborate, right? You cannot say, I will not talk to any specialty, I will not talk to radiology, I will not talk to ambulance, I will only treat and go. No, You're so used to that you have at some point 5-6 people wanting your time, right? This is what an administrator does too. At some point, you have 5-6 problems on your head trying to solve. And we are not afraid to be wrong because we want the work to be done. It may not be perfect, but for that time, that's the best solution. And we are problem solvers. There are many, many very uncommon or very different pathways where medical tech or a EMS as pathways that we can take as emergency physicians, which probably other specialties can never understand or fathom. But as emergency physicians, we are very well placed to take all these paths. Next slide. Well, while we have advantages that we are emergency physicians and how we can be medical administrators, we also have few challenges. What are they? Unlike in emergency medicine that you see a patient, you solve or you maintain the airway, you tube, patient gets better. In administration, it does not happen like that. You will need patience, you will need time, you will need efforts. The results come later. They take time. They usually take time. This is a challenge for us as an emergency physician. And I did this for many years and I would at some point become so frustrated. But I realized that I'm dealing with a different problem. So remember that it takes time. I call, this is mostly a soft role and not a hard role. The meaning here is, it's not about yelling and shouting. It is not about saying this is the best way and this is the only way. A soft role is knowing how to take everybody's perspective, still getting your point across. This is a skill that you will build as you grow, but understand it's not the hard role, it's the soft role that matters. Identity crisis, well, yeah, you'll all go through that, I'm sure, and all of us have gone through it. Let me be very clear, and at least let me be honest with myself. At some stage, after you do the same work for many years, you're wondering, what am I doing? And if you're going through that, it's a positive thing. It's positive because you have an insight to what you think you're doing and what you think you should do. So people call it identity crisis. It is usually an identity opportunity. When you feel in this mold, sit back and think. It's good. Don't fight it. Observe it. Think about it. And do what is next best needed. Administration does not have pathways. There are no algorithms which says cardiac arrest, adrenaline, second stage, third stage, shock. No. It is not in a fully evolved, protocolized work that we are used to, right? So understand there are few challenges which will come not written in the book, and I'm sure you will figure it out as per the need. The very common comment that you will get when you want to aspire to become a medical administrator is, you're looking so young, you're so young. It is a plus and minus, but, no, anywhere in the country, medical administration is not looked at as a retirement option or somebody who doesn't know clinical. It is now sought after because they need young people who can be agile and adaptable. And that is your strength. If somebody says you're young, you say, yes, that's my advantage. So don't let anybody say you're young. And if you see the gray hair in me, that's a very, very intentional method to say that I may look young, but I'm not as young as you guys think. So you can give the physical cues, but don't let them bog you down by calling you young. This is a common thing that comes. So do you have foreign experience? Are you from US? Are you from UK? Have you done from Australia? Because it's a very, very clear misnomer among healthcare that medical administrators have to come from the West or should have worked outside and should have been Firang at some point. I don't mean in a in a negative way, but I'm saying in this day and age, all of us know all the protocols countries follow. So you don't have to have this foreign accent to become an administrator or an experience to become an administrator. You just need to know the knowledge, and that is freely available all across. Like I always say, one step at a time. Please don't hurry. Don't stop and start doing something. Continue what you're doing. Build your brain to become what you want to do in the long term. Okay. Next slide. That's, I'm sure all of you know what is SMART goal setting. Ensure what you aspire to become is very clear. I want to become director of medical services. I want to become head of clinical services. And measurable. I would want to manage ABC. And what will I take for me to reach there? And most important thing is it relevant to you? Only one person can answer that, and that is you. And when you have a goal, please make it time bound. When I started, I gave myself 3 years. When I was doing my MBA, I completed, I said, okay, now what do? I will give myself 1 to 3 years, and then I'll take a call whether I need to put my leg into both or not. And it definitely works out. If you don't keep it time bound, you will lose the path. So please keep it time bound. Next slide. There is only one line that I can tell you for people who are listening to all this and saying that, well, I understand what you're saying. I get what you're saying, but I'm not sure. If you're not sure what is going to be your next path, if you're not sure what you're going to do next, please take action. Go pursue a degree. Go read it. You don't have to take 3 years MBA, 2 years MBA. No, just pick up books. Pick a book, read about it. In your hospital, what is the burning problem? Let us say in your hospital, your burning problem is that, your patients are not getting beds. Go sit in that table. See if you can solve that. Understand the problem. You will never evolve if you say that is not my problem. You will evolve when you say that I will be part of the problem and understand. And trust me, when you do this micro learning is when the macro learning comes out of it. So please read books, please update and understand, like you keep reading your latest algorithms, latest protocols, learn what is the latest thing to do with your hospital, with your healthcare, with education. So keep your reading wide. I see many people reading just one topic. That's what I'm going to do. Trust me, the best ideas will come when you think laterally, not just one way. So keep your knowledge wide enough. Read all aspects. Okay. You'll be, I read all kind of authors. I listen to a lot of podcasts, but that's my way of learning. So look at what you think is good. Pick it up. Next. This is a question I keep getting asked by a lot of emergency physicians. Sir, you're becoming emergency, you're an administrator now, you are a, medical services head. So it is always good on that side. In emergency, this is always like this. Grass is always greener on the other side. But you know what is the important continuation of this adage? Grass is greener where you water it. If emergency is where you want to love, water it. If you think administration is my cup of tea, then water it. So grass is greener where you water it. So remember this, grass is greener on both sides, provided you want to be on the both sides. Next slide. This is a $1 million question most of us go through. Some days, there are days that you wake up and you say that I can't see what I'm doing. I can't see my way around. And I always remember there's a beautiful story that, boy leading the horse in the forest, and he just can't, he's so worried because he's lost in the forest. And he asked the horse that I'm worried, I can't see through. I can't see my way through. And the horse only says that, can you see your next step? And just take it. Whenever you feel you're anxious about your life, your career, and what you want to do next, stop, see what is the next step that you can do, take that. One step at a time, I'm sure you'll reach your goal. Next. I have tried to do justice for the time given to me with a lot of anecdotes related to clinical and paraclinical. My intent was not to be didactic at any point. I didn't want to be sounding preachy that all of you should do it. Whether to do it or not is definitely your call. My responsibility was to tell you how are things on the other side and what are the abilities as an emergency physician you need to develop to become a good medical administrator. Thank you. Thank you to Yashoda Group. Thank you to all of you for your patient listening. I hope you all enjoyed as much as I did. Over to you, Kiran.
Yeah, thank you, Dr. Nischal, sir. Undoubtedly, this is a fantabulous talk. Thank you so much. So we learned many things from your sessions, like dealing with the VP patients. So then, and what is the importance of data? So management of overcrowding. So how to cope up when ER was so busy and all. Then importance of ER manuals, policies, procedures, and evidence-based medicine practice. At the same time, conflict resolutions. Then some challenges like, so identify, then crisis management, identify crisis, then problems, and then how to solve it, then how to speak with other people. So not like, as it told, hard, no? So hard, soft and hard roles. So when to play soft role, when to play hard role and all. So really quite interesting. It is so informative. Thank you so much for it, sir. So can we take any questions?
Please, please. I am not able to
see any questions. I couldn't see any questions over here. If no questions, we'll wait for 1 or 2 minutes. If no questions, then
sure.
So really, it's so informative, sir. Thank you so much. I learned many things from your session.
Thank you.
All this while, all this while we are thinking about ER. So now I realized why Srinath has selected you to talk on this topic. Like you started as a ER resident, then registrar, junior consultant. Now you are the clinical head of the clinical services at what is it? Cloudnine. Cloudnine group of hospitals.
So
you are the right person to talk about this topic.
like I said, Kiran, I've spent time years in every step as a medical officer, resident, JC, consultant, regional head, then a country head. But I'm so glad I did it one step at a time because I had time to develop the qualities that I need to take up the next one. And I am again telling you that it is not necessarily everybody should pursue this.
Yeah, true.
You need to know whether this is the right thing to do. 10 years ago, when I was doing it, everybody asked, why are you doing it? Okay. But I can only say I'm so glad I did that at that time. And that's serving me well now.
Yes, sir. True. That's why you are the right person to talk on this topic, sir. So further, we should thank Srinath, sir, for selecting an appropriate candidate to talk on this topic.
Thank you. Like always, Srinath has a talent of identifying who should do what.
Yeah, true, sir. So as of now, no questions. So we'll move on to closing session. So I thank Yashoda for supporting all the aspects of to conduct series of webinars. Then I thank Semi-Board and Envoy. So especially Dr. Srinath sir, who is there behind this show, and he put a lot of efforts, right from the selection of topic and the selection of the speaker, then how to get the quality of the speakers into this particular movement. So for that, I should thank Dr. Srinath sir, then all the attendees, then all the viewers of this webinar. Then once again, I'd like to thank Dr. Nischal sir for his extended elaborated talk. Thank you so much. Thank you all the viewers.
Thank you. Thanks, Yashoda team. Thanks, Dr. Srinath. And thanks, Kiran, for making it so happy and jovial discussion and not a very tight discussion. We all are friends and colleagues. And it was a pleasure. Thank you.
Thank you, sir. Thank you.